serves to remind all of us the importance of this malaria forum, and indeed the need for quality and results-oriented healthcare in general. Novo Health Africa as an organization is committed to actively raise the quality of healthcare of Nigerians regardless of their socioeconomic status. And we have tasked ourselves with engaging all stakeholders to make this possible, and also in fulfillment to our vision towards the advancement of individual, family, and community health for social development and economic growth in Africa region. Every month of April, yearly, and this is done globally, malaria takes center stage. And on the 25th is the set-aside date by WHO to commemorate malaria. So today we're setting the ball rolling with a mission to creating awareness, supporting the approved guidelines, treatment protocols, prevention and control interventions for malaria, with a focus to addressing the Nigerian challenge. For many years, Nigeria and indeed the rest of the world has committed huge resources in the fight against malaria. No doubt we've recorded measurable and significant successes. But however, the desired ultimate goal is to see the elimination and finally global eradication of malaria. And we think this is possible because in the course of history we have seen other infectious diseases that have also met this fate. And I believe and I'm certain that everybody here shares the same desire. So what is our responsibility in this struggle? Is it the fight left for top executives in the offices of the Federal Ministry of Health, the international agencies like WHO? To what capacity are we called to act? What about collaboration? How can we collaborate and at what level? These are pertinent and reoccurring questions that come up in forums, conferences, seminars, and gatherings such as this. We're called here today to take action. It's a call for action for all stakeholders to get involved, from the very simple, basic, fundamental things such as raising this awareness to the even more complicated and specialized areas of research and technology. In Novo Health Africa, our business enables us to come in contact with numerous data. We have our esteemed providers, our hospitals, who work with us. And we have seen a lot on malaria in terms of data. Sometimes able doctors, we see things like malaria, rule out typhoid, typhoid rule out malaria, and it's all so confusing. I believe that at the end of this program, we will all be more enlightened and more ready to take up this fight. So ladies and gentlemen, prepare yourselves to be excited, challenged and inspired to take up this fight. We have today with us Dr. Wellington Oyibo. Dr. Wellington is a consultant parasitology in Lutz and also a member of a WHO expert team. We also have Dr. Tolu Arowolo, who is from WHO herself and is a professional officer in malaria. Both of them have done numerous work and research on malaria, and I'm hoping that their vast experience will contribute immensely to this forum today. So I encourage all of us to listen to them and take advantage of their presence here today. But before I round up, I would like to say a special welcome and express my sincere gratitude to the Executive Director, Rain Oil Limited, Mrs. Godry Ogbeche, and the Managing Director, CEO of NCR, Mrs. Choma Sideso, for their support to ensure that this forum happens today. On behalf of Novo Health Africa once more, distinguished ladies and gentlemen, I welcome you all to this forum. Thank you.
Thank you very much, Mark. I would like to quickly recognize the presence in our midst of the National President of the Healthcare Providers Association,